My name is Sue Parks. I'm the CEO of Orange County United Way, and welcome today to our virtual town hall. And we're going to be discussing COVID-19 and the homelessness population here in Orange County. So thank you for joining. We're going to try to address as many of the questions that came ahead of time in the comments from our amazing panel. And now it's my pleasure to introduce the chair of the United Way board. He's also the executive vice president of public affairs for Five Point Holdings, as well as he's part of our executive council for United to End Homelessness. So on behalf of United to End Homelessness, thank you for joining us. And now let me turn it over to Steve Churm.
Forgive me, you'd think I'd learned by now. I've done enough Zooms here in the last 7 weeks working remotely, so I apologize. Thank you, Sue, very much for the introduction, and good morning to everybody. You know, as a resident of Orange County, I am concerned about the health and safety of everyone, particularly those who are most vulnerable, and that includes our homeless population. In our last point in time count, we counted about 7,000 individuals experiencing homelessness in our community, old and young, male and female, veterans, and everyone being someone's son or daughter or family member. At the last count, there were about 2,900 in shelters and nearly 4,000 individuals living on the streets. While we know that many more emergency shelters have opened since that count, that doesn't change the fact that there are 7,000 men, women, and children are at risk today of contracting COVID-19. And it is clear more than ever that we need to care about these neighbors because their health impacts our health. To share what Orange County is doing to support this vulnerable population, we are very fortunate today to have 3 experts joining us for a brief overview of our response. First, Lilly Simmering, Assistant Director, Orange County Healthcare Agency. Whitney Ayers, Regional Vice President, Hospital Association of Southern California. And Dawn Price, CEO of Friendship Shelter. And she is also a member of the Continuum of Care Board and is the chair of the Shelter Committee of that board. Now in California, we have all been under a stay-at-home order since March 19th, but you can only follow that order if you have a home. So today we wanted to provide an update as to what is being done to assist Orange County residents who don't have a home to call their own. And I'd like to begin today, Lilly, with you. If you could give us an overview of what the County of Orange is doing in this important space. Lilly?
Wonderful. Can everyone hear me? Looking at Steve, hopefully he'll nod and say that yes, he can hear me. Yay,
perfect,
wonderful.
perfect.
Okay. So the county has been very busy focusing on this population since the governor's stay-at-home order has been issued. And I think that the effort that has been most prevalent has been Project Room Key. And as many of you know, this is a state program with the initial funding came from the state, about $150 million. And then most recently, FEMA had approved funding for non-congregate shelter living, which is where majority of the funding will be coming from for Project Room Key. Project Room Key is designed to provide safe, isolated housing for those who are home challenged when it comes to isolation. The primary recommendation there is that these individuals be housed in hotels, motel situations, a situation where you could easily access a bathroom, a personal bathroom, and have your own personal space to recuperate from COVID-19 or whatever element that you have that qualifies you for this particular project. As of today, the county has around 545 hotel rooms. They are all spread throughout the county. We have 2 that are specific to those who are sick or symptomatic. And then we have 3 that are open to those who are part of the at-risk population, meaning those who are 65 and over and or have an underlying chronic disease. This at-risk group is the group that is most susceptible to the serious symptoms of COVID. We also have Joplin, which has a max capacity of 100 beds. And that facility is being used right now to primarily house those who are asymptomatic from the South Service Planning area. To date, we currently have 44 who are sick and symptomatic and are in shelters. We have 112 who are part of the vulnerable population. And we have 20 up at Joplin for a total of 176 individuals who are currently being housed. We are working diligently and have worked diligently with all of our shelter partners and providers, the hospitals, outreach organizations, and local law enforcement to quickly and rapidly identify these individuals so that they can be placed into these accommodations. And so far it has worked well. It seems that everybody has acclimated to what the process is. And as is with every new process and program, there's always a bit of time where you need to kind of acclimate, work out the kinks and retweak and all of that. But again, I want to reinforce for everyone that this was a process that we designed with assistance from public health experts. And so we do have a rapid response system in place to deal with individuals who do become more symptomatic over COVID or who need additional medical assistance once they've been released from the hospital or are COVID positive but do not need hospitalization. So for the most part, I think that we are still making this a priority for us. We appreciate all the support from communities and cities who have been very open to this concept and have been welcoming, and there have been some wonderful partners in this particular program, and I want to take the time to thank them. And at this moment, that's basically Project Room Key.
Thanks so much, Lilly. We appreciate your energy and knowing that you're leading this effort to really help those most vulnerable in our community. So thank you very much. I'd like to turn now to Whitney to really talk about the impact on the hospital system due to the virus as it specifically relates to the homeless population. So Whitney, what do we need to know as it relates to homeless and the hospitals and much of what we've read and kind of clarify and give us a real-time update?
Oh, okay, I think I'm off mute. Am I off mute? Okay, great. Thank you so much. Good morning, everyone. So probably not surprising to the community that Orange County is at only about 60% occupancy with our hospitals. This is not dissimilar from other parts of the state, but what may be of more interest to this group is the increase in homeless that are really vulnerable and sick that are actually accessing the hospitals during this time. So I do want to provide some facts and figures. Anecdotally, a lot of these very sick and vulnerable members are known to the hospitals, but what has been surprising is that a number of them who are very sick are new to accessing the emergency departments and requiring inpatient treatment, which is a little unusual, and we have seen a decrease in emergency department utilization because folks are just not wanting to be infected and going to the emergency department right now. So I do want to share a few statistics about patients that are homeless that have comorbidities and complicated health issues that are considered chronic, and the types of profiles that we are seeing in the hospital. So obviously our number one category, 1 in 3 of the patients that are accessing the hospitals have a mental health disorder. And when I say a mental health disorder, there's 5 categories. The top 2 most frequent would be alcohol-related use disorders and schizophrenia and other psychotic disorders. 90% of those who are accessing the hospitals right now have a, quote, chronic disorder. So these are very sick individuals that need management, appropriate management. The emergency departments, just like the overall hospital census, they've seen a dramatic decrease in the number of patients that are accessing their services because they're either scared to go to the emergency department, they're putting it off for a number of reasons. But within that category, the homeless, we've seen a 20% decrease. But what's interesting is of that 20% decrease, the number of those accessing emergency departments that need inpatient level of care, meaning they've gone through the emergency department and now they've been determined they need inpatient level of care to be admitted to the hospital, has increased dramatically, underscoring the fact that we have very vulnerable populations that still need these services that the county is standing up as we speak. Just a few facts. So 75% of our admissions are males between 45 and 64 years of age. Psychosis is the major factor for the need to have an inpatient treatment, followed by cellulitis, heart failure, and septicemia, very, very serious conditions. So I share these figures briefly just to kind of underscore for our community that we are seeing very vulnerable homeless in our hospitals, even though it looks like in the media the hospital volume is down. And these are just a few figures. I guess in conclusion, I would say hospitals are really designed for episodic acute care treatment. They're not designed for therapeutic recovery environments, which is what this population requires. And we just want to applaud the leadership of you and Sue and United Way for bringing us all together to have these conversations. And we are so grateful for the county's leadership in expanding into different populations. So we look forward to supporting you all. That kind of concludes my report, Steve.
Thank you, Whitney, very much. Once again, we've learned through this episode that data is so important to really understanding what's going on. So some very interesting information to really suggest how critical the need is for the homeless that are suffering during this. So thank you, Whitney, very much for really going deeper into the numbers and helping us understand. Appreciate you, and I know how busy you are. So thank you for being with us. I'd like to turn now to Dawn. And Dawn, you are a long experienced leader in this community in the homeless space on many fronts. But today your organization is important because we want to talk about a shelter that you run. Can you talk to us a little bit about what's really happening in the shelter, what you're seeing anecdotally, and it would be very interesting for our audience to understand that. So please, Dawn, the floor is yours.
Thanks so much, Steve. And I appreciate being a part of this wonderful group talking about this important issue. As you mentioned, in addition to the housing that we provide, we also provide 2 shelter programs, actually, both located in Laguna Beach. And early on, as this system was developing, we were really blessed with some wonderful staff leaders, including folks that really focused in on what we were going to need in following the science, in looking at what the CDC was recommending and what HUD was recommending, in addition to the HCA requirements that came out, trying to understand the best way to implement these strategies within our shelters. Shelters are unique environments, and even the 2 shelters that Friendship Shelter provides are very different. We have one that's a single room where everyone is on a mat on the floor, and then we have another that's more of a residential setting, more like dormitories, where 3 or 4 people per room. And so pivoting and understanding how to operate our shelters during this crisis was an important but difficult challenge. Basically, we followed the same tenets that all of us are providing in our own homes. We're trying to keep people at home. And in the case of people who are staying in a shelter, that means at the shelter for the same kinds of reasons, only leaving for the same reasons that you or I would leave our home environments. We're trying to increase hand washing, increase cleaning surfaces, all the same things we're doing at home. And then in addition to that, we're trying to add, which is a big challenge, social distancing within shelters. Keeping people 6 feet apart in a congregate shelter is a very big challenge. We're being creative. We're also needing to, though, decrease the number of people who are staying in shelters right now. And that's why solutions like Joplin and solutions like Lilly mentioned as far as the specific populations are really critical to keeping that shelter census down. We are using masks in both of our shelters. Both staff and guests are wearing masks. Staff are using gloves for any handing out anything or doing anything that would mean contact with folks to decrease the possibility of spread. And we have changed the way we provide meals from a potluck type of setting to a I'm going to hand you your plate, and that limits as well the number of people coming in contact with meals. We've been very fortunate that our meal volunteers, many of them, are still providing donated meals, but that does require for our staff to have sort of a contactless receipt of that meal, and then we're providing it plate by plate, as opposed to the way we really love to do meals in shelters where the volunteers come in and provide and serve. So those are all some changes we're making. I do have to say that our shelter guests are resilient people. People who are experiencing homelessness have learned to be resilient. They have learned to make the best of very bad situations, and we're seeing that happening among our shelter guests now. But we do have those challenges that Whitney mentioned with mental health, and I think all of us in society right now are struggling a bit with our mental health. This is a challenging thing to do, and when you have a chronic mental health condition, that's especially challenging to manage right now, and we do see that in the shelters. It's a new normal, and everyone is coping as best they can. I'm so grateful to our staffs for their terrific attitudes, the way that they keep spirits up within our shelters. They provide consistency by coming to work every day and implementing all of these changes. And it's sad to say that shelter workers are forgotten a bit when we talk about essential workers right now as heroes within our society. So just a shout out to them. Just want to also a shout out to Lilly and her team. We did have a really great experience when we had 2 folks within our shelter who had some symptoms. We called Illumination Foundation, which is the provider for Project Room Key. They were able to come out same day and take those 2 individuals to one of the hotels that is set up for people with symptoms. They were tested there. The tests were negative, and they were transported back to our shelter. And we had the certainty then that we did not have someone who could have the potential for spreading the virus within our shelter. So we really appreciated how smoothly all of that went. I think all of our shelters need right now cleaning supplies and hand sanitizer. Those are 2 of our biggest needs. As well, we need meal volunteers. Some of our volunteers are in the medically fragile group themselves. They have chronic illnesses, or they're in age groups where they shouldn't be out and about. And so we need to have more able-bodied people filling in at this time. And if you're home alone with your family, what a cool thing to make a meal for a shelter and bring it by. And so we do need those things right now. I'll leave it there. It's been a challenging time, but we're learning a lot.
Dawn, thank you so much, and appreciate really your experience and your optimism. You used the word resilient. And I think it's a word we've heard a lot, but you really have to understand the definition of that word is how quickly we can respond to difficulties. And the fact that you're seeing that is very optimistic, and I'm delighted you made that point. Thank you. In the time we have remaining, we have questions that you've submitted, and we thank all of you for participating and really helping make this a true information exchange and very robust. I'd like to start, Lilly, I'm going to turn to you first. We've had a number of questions from attendees regarding what will happen when Project Room Key ends. Some communities are now talking about purchasing or acquiring the hotels that are being used to convert those into permanent supportive housing. And I'd like to find out what the county's thinking is on that, and what role they may play in this option. And secondly, if you can just help those listening and following along to understand how they could refer somebody to Project Room Key. So 2 questions there. What's the county doing in this space, particularly once Project Room Key from a state level slows or ends? And how can somebody right now refer someone to that program? Lilly?
Sure, Steve. Let me take the second question first, because I think Dawn gave a great example of how the process works. And so right now, Project Room Key is accessible by shelter providers, law enforcement, hospitals, and outreach teams. Outreach teams would be organizations like CityNet or Mercy House, who have teams that go out on the street every day and are interacting with our unsheltered population. As Dawn mentioned, each of these entities have a phone number, in which case they can call. Illumination Foundation will come out. They will do a preliminary screening and they will remove the person immediately. So of course, the natural question is so what if I come across somebody on the street? Well, hopefully our outreach team will be there. Healthcare agencies outreach and engagement team, which many of you know as the blue shirts, have the ability to make that referral. You can call OC Links, and that's how you will get a hold of our outreach and engagement team, and they can come back and look at an individual and help get them into Project Room Key as well too, if they fit that criteria. If they do not, of course, our goal is always to get them sheltered in the best possible arrangement for them. So we will always be working with them to see if they can access a shelter if they're willing to go as well too. So that in a nutshell is really what it is. These are not walk up, walk out facilities. These are COVID treatment or isolation facilities. I should say treatment because there really isn't much of a treatment there like a hospital, but it's for the purpose of isolating somebody who has COVID because they can't do so, obviously because they don't have a home. So, you know, it's not walk in, walk out. There is security there that Illumination Foundation oversees and works hand in hand with us to make sure that we are good neighbors in the communities that we are in. So I will move on to the second or the first question you asked about what happens after Project Room Key. This is a conversation, it's a lively conversation up in Sacramento right now. And I think that for those of you who are very familiar with the homeless situation, especially here in Orange County, we've always been kind of trying to noodle in our brain, you know, how do we do this? How do we tackle this problem? There are so many individuals who can use housing and who are in these situations. The conversation at the state level is, and I believe the governor had spoken about Project Room Key about 2 or 3 Saturdays ago, and what he has outlined as what the state would like to see happen post Project Room Key. But before I move on, let me make it clear right now that we do not know when Project Room Key is going to end. That is completely dependent on the governor and the state. So when they give us that date, we will have a better idea of when the end date for Project Room Key is. As of today, I do not have any indication of when that date would be. I do not know how much of that timeline is tied to what the governor has been messaging on his reopening strategy. So right now up in the air is the date in terms of when Project Room Key ends. Now, if and when it does, yes, the conversation around whether or not there are opportunities to purchase some of these motels and hotels that have been housing Project Room Key clients would be ideal for purchase so that they can continue to be permanent supportive housing or housing in general for this particular clientele. I wish I had more specifics, but I would say that from my conversation with the state, they are very much in alignment with this. This is something that they think is a great opportunity at this moment. At the local level, we've been in multiple conversations with different stakeholders who understand what that looks like. And we are looking at it from all points. There's always, of course, a question around financing. Where is that money going to come from to purchase some of these hotels and motels? How much of that responsibility is on the county, the cities, the state? So the conversation is ongoing. I wish I could tell you that there's a pathway or that there are, you know, indicators or there's a framework. At this moment, I am not aware of one, but I can assure you that the conversation is very robust up at the state level.
Thank you, Lily. Don, following up on that, if somebody is watching or listening to this, and just as a local resident, somebody in our community that believes this is a viable option going forward, how would you, as somebody who certainly understands grassroots, understands how to mobilize advocacy, how would you really recommend somebody make their voice heard, that we encourage city and state leaders to really get behind this idea going forward long after the COVID-19 has left us?
Well, one thing I would certainly suggest, United to End Homelessness has a link on their page to become a housing champion, and signing up there with your specific city of residence will get you targeted information about when it's most effective for you to reach out locally to advocate in favor of the kinds of solutions Lilly is talking about. This is going to be critically important because this process has identified the most medically fragile people among our homeless population, and the opportunity we have with them in hotels and safe is to catapult them into housing without having to go back to the street, back to shelter. So I really urge people, if this is something that interests you or making sense to you as you're watching this, that you go ahead to the United to End Homelessness website and sign up to be a housing champion. If you have relationships or know directly your local city council, city managers, mayors, please make them know you are supportive as well. This is a difficult time for advocacy because it's all virtual, but at the same time, people have time to make that extra phone call or make that extra connection. So I hope we'll do that.
Terrific. We just have a couple of minutes left, and a question really for all three of you, and I'm going to go to Whitney, you first on this. This is not a question that was certainly submitted to me to ask, but one that is a longtime storyteller, journalist in my past, I want to ask. What are one or two lessons from your perspectives, your space, your work that we've learned out of, that we should take from this COVID-19? Something that, you know, you've seen, you've learned, maybe it's optimistic, maybe it's hopeful, but a couple of lessons from the hospital perspective, Whitney, that have come out of this that we need to make sure we take forward and not repeat again to avoid this kind of situation we're in. Whitney?
That's a really lofty question, but I think I would say number one, hospital preparedness has probably not been prioritized since 9/11. And I think we are heavily reliant on our county and state and national stockpiles for supplies, and that has proved to be problematic for us. So I think shoring up our local stockpile availability is number one. Number two, I would say the adequacy of testing environments. We have waited on federal, state guidelines on who to test, when to test. And I think our health systems, to their credit, have been really proactive about testing populations in their networks. We are working with Lilly and others about how to expand that, but I think we can open up our economy once we have kind of a broader testing network. And I know our hospitals are doing an adequate job, but I don't think that we anticipated the shortage of swabs and other things and the reliance on government stockpiles for supplies. And I think that's hindered our efforts.
Preparedness certainly is a lesson for all of us, personally and professionally. I no question about it. Great points. Appreciate it, Whitney. Lilly, I'm going to turn to you. What one or two lessons are you taking out of this, or the county may be taking out of this at this early sort of evaluation stage of this pandemic?
Sure, thank you, Steve. I definitely echo Whitney's comments. You know, our public health director just recently retired, and so now I'm wearing two hats. I'm the acting interim public health director as well, and in that particular position, everything Whitney says is absolutely 100% true. We could be better prepared. We could have been, you know, better in a lot of ways to deal with the situation that we're in, but it's okay because you know, this is the first time that something like this has happened in a while, and we did not anticipate that it would be to the level that it has been. But now we know, and I think that for us, with my public health hat on, I would definitely support Whitney's comments, and that's what we need to do moving forward. Now, in regards to the homeless population, what have we learned about how we would work with that population in this particular situation? I think that what we have learned is also very much in line with what Dawn had said, that this population is quite vulnerable. And to make assumptions right off the bat about when you see somebody, who they are, what they have, what they don't have, I think would be careless, because you wouldn't know exactly whether or not they are, somebody with underlying conditions or not, and to kind of write them off that way is inappropriate. So for us, I think that what we now have built with Project Room Key is, I would say, a model on how we can move forward in terms of, looking at that aspect of the homeless population, right? The physical health of the homeless population, so that we can more accurately address it. For a very long time now, we've been so focused on the mental health of the individuals. And I'm not saying that that is not a need. It is definitely a need. But now I think we are seeing it more than ever, that the two do coexist together, and the two does eventually make an individual very fragile and very vulnerable. And I think that if we move forward with that learning then about this particular population, and then we could maximize our resources and be a little bit more innovative about how we approach this population moving forward.
Terrific. Thank you, Lilly. And you look remarkably refreshed for wearing okay.
The makeup is working well for me these days.
It's working, okay? And I'm going to give you, Dawn, in the final 60 seconds, the final word, but I do have to comment. I am also a Green Bay Packer fan. I see the over your shoulder.
I wondered if anyone was going to see that.
Oh,
Yay.
yes. No, I'm hoping for football. But Dawn, you have the final word here in our last 60 seconds.
Thank you. I would echo what everyone has said. We've certainly learned all of those lessons as well. Friendship Shelter has more people in housing than shelter. And the biggest thing we've learned, it's really a reaffirmation that housing is health, and that people who have a home are much more able to be safe in a situation like this. It's been much easier to support our housing than it has been to support our shelter clients, because of just the fact of how they live. And we've had the partnership of United Way's homeless prevention program in supporting some of our housing clients, and that's been very, very meaningful as well. Overall, though, if you have 4 walls and a roof, you're better off in this situation than if you don't. And we've learned that over and over through this episode.
Thank you, Dawn, very much. And I would like to thank all 3 of our panelists, Lilly, Whitney, and Dawn. Thank you for not only taking time out of your incredible schedules right now, but thank you for being leaders. Thank you for being voices for those who are most vulnerable. We can't thank individuals like you enough, as many times as we can. So thank you so much for being here today. In closing, I want to mention that I'm very proud that the homeless prevention program that was piloted by United Way and funded by the Pandemic Relief Fund, through that effort, we have now helped just about 800 households so far with direct financial assistance, $500 per household. And we encourage people to continue to donate to our Family to Family program. Your $500 will help a family in need today. So we're very excited and very proud of that, and thank everyone on this call that's participated in that. Again, thanks to the panelists. This information was incredibly helpful to us, and we will be doing more in future sessions to build upon what you've heard today. If you asked a question, or if you submitted a question, it was not asked, we will cover those questions in future sessions. So stay tuned, follow us. In the meantime, stay safe and be well. Thank you for being here today.